Joel Opio is one of the many children who were affected by the nodding syndrome in 2005. Joel was in primary 1 by the time he was attacked by the disease. He's now aged 23, but stunted and malnourished.
It started like malaria, but after treating the malaria, the thing started persisting when the boy was always dizzy, as if he was suffering from sleeping sickness. The doctors, which were coming from Gulu, confirmed that the kid was suffering from nodding syndrome.
Joel's mother, Sophia Okidi, has for the last 16 years endured a lot of suffering to look after her son.
His mental capacity has dropped. If you go to the garden, you leave him at home, he picks fire and burns the houses. So all the time, you should be with the kid.
Joel, a resident of Redadam A village in Aromo sub-county in Lira district, is not alone. 21-year-old Maurice Omeny and 15-year-old Catherine Akawo were also affected by the nodding disease.
Omeny Maurice, ene yetie ni peko na machiel. Omeny tuo meti komeni, ti yelo. Ateka.
In Omeny, always collapse. He cannot move. So there, the child is they have to look after him when the season comes, because all the time he's just collapsing.
Despite the challenges they face, Maurice Omeny goes to school frequently, but he has been in primary 6 for 9 years. These and many other school-going children in Northern Uganda are stunted and malnourished.
Most of the vulnerable groups like children are stunted. Actually, we have the highest proportion of people who are stunted. From the baseline which was done, up to 40% of our children below 5 years are stunted.
Dr. Omeny is a senior lecturer and coordinator of graduate research at Lira University in Lango sub-region. He's leading a team of researchers under Dinuche's project, a development initiative for Northern Uganda.
The damage caused as a result of this nodding disease is irreversible. Up to now, nobody knows exactly what is responsible for that.
This is an European Union-funded project championed by the National Agricultural Research Organization NARO, together with Lira University, Muni University, and PAMCOP, under the supervision of the Prime Minister's Office.
So basically, our intervention is to help the households to find better way of preparing appropriate food for these children. We have been to a number of households. Actually, you'll find they are fed on one type of food day in, day out.
The children will be provided with a diversity of foods and supplements from the locally available food in order to deal with the challenges of poor nutrition among the communities in the region.
I recommend that at least each family eat a variety of between 3 to 5 in a day, so that they can be able to get energy, proper protein, malakwang, bo, cabbages, eggplants, French flesh potatoes, which has vitamin A. That is one of the commodities being promoted by NARO. Even beans, there's what they call iron-rich beans, and we are encouraging use of simsim, nuts.
The poverty alleviation intervention for the people of Northern Uganda is tailored towards establishing farmers' cooperatives and farmers' hubs, which will teach farmers on how to plant crops that will be used in solving the malnutrition problem.
These are nutrition-specific interventions, but our colleagues from PAMCOPs will also be teaching the farmers group You know, this narrow intervention is based on the farmers' cooperatives, the village, the community, the sub-counties that we are intervening in.
Apart from the farmers' groups, the project is also targeting selected schools to teach children so that they can plant crops and vegetables by themselves.
Simple foods, like for example, we have developed what they call home gardens, school gardens.
So their prayer is any other organization should also support the young ones who are not suffering from this disease.
The problem of nodding syndrome is still a problem to parents who have children affected by nodding syndrome in northern Uganda. However, researchers at Lira University are coming up with a solution to deal with the nutrition challenges the parents are facing with their children in northern Uganda. Jingo Francis, NTV, in Lira District.